How do EMG and nerve conduction studies diagnose muscular dystrophy? Imagine trying to figure out if muscle weakness comes from the muscles themselves or from the nerves controlling them. Electromyography and nerve conduction studies are key tools doctors use to make that distinction. These tests help identify whether the problem is in the muscle tissue or the nerves. Electromyography involves inserting very thin needle electrodes into specific muscles. These electrodes record electrical activity when the muscle is at rest and during contraction. In muscular dystrophy, the electrical signals often show a pattern called myopathy, which means the muscle fibers are damaged or regenerating. You might see small, brief, and polyphasic motor unit potentials, indicating muscle fiber degeneration. When the patient contracts the muscle during the test, the electrical signals are displayed on a monitor and heard as sounds, giving doctors a visual and auditory picture of muscle health. This helps differentiate muscle weakness caused by muscular dystrophy from weakness caused by nerve problems. Nerve conduction studies are performed alongside EMG to measure how well the nerves are working. They send small electrical impulses along nerves and record how fast and how strongly the signals travel. In muscular dystrophy, nerve conduction studies usually show normal nerve function because the primary issue is in the muscle tissue, not the nerves. If nerve signals are normal but EMG shows signs of muscle disease, this pattern supports a diagnosis of muscular dystrophy. Together, these tests give a complete picture. EMG detects abnormal electrical activity in muscles that suggests muscle disease. Nerve conduction studies confirm that the nerves are functioning properly. This combination helps doctors confirm if muscular dystrophy is the cause of weakness and rules out other nerve or neuromuscular junction problems. Doctors often use EMG and nerve conduction studies along with other tests like blood tests, genetic analysis, and muscle biopsies to make a final diagnosis. These tests are safe and provide valuable information about muscle health. If you or someone you know is experiencing muscle weakness, talking to a healthcare professional about these diagnostic options is always the best step. Remember, each person is different, and a thorough evaluation helps ensure the right diagnosis and treatment plan.